Hello, this is Dr. Sam Madeira, founder of Apollo Health Clinic, and I want to welcome you back here to day 6, and we're going to be talking about testosterone, men's hormones, and men's health. So I'm a man, obviously, and I know a lot about men's health. I've seen many men and many women, and I've run men's health clinics in the greater Seattle area. So I've seen men on testosterone therapy, off of testosterone therapy, in between, and all the above. So often what happens as we age as men is testosterone naturally decreases. This can actually happen any time in our life, contrary to popular belief. One of the most surprising things for me in my practice over the years is that I've seen men in their 20s as well as their 70s and anywhere in between have low testosterone. We call this in medicine andropause. So it's a male version of menopause, but unlike menopause, it doesn't just happen around age 45 to 50. And it's actually very, very common. So if you're experiencing decreased libido, problems with energy, endurance, interest in hobbies or activities or sports endurance that you didn't have problems with before, you could have andropause. The two main things to ask yourself is, do you have a low libido and do you have problems maintaining and keeping an erection? If you're not getting an erection every morning, then that's also a red flag. Also, an important side note is erectile dysfunction is a true sign that you have vascular disease and that your arteries down there in your penis are starting to get clogged up. So you need to get some advanced cardiovascular testing, which I do at my clinic, to assess how severe this clogged artery problem is and get this treated as well, not just get on hormone replacement therapy. So more about testosterone. Most men, they go to their primary care doctor and they check their testosterone and they don't know if their testosterone is the right level or not. And you may, if it's very low, get put on androgel. And androgel is a gel made by pharmaceutical companies. It's a medication. And men typically notice no improvement with this medication. And you can get things like mood disorders. You can also notice more fatigue. Your breasts could turn into man boobs, which none of us want that to happen, and your erections don't improve. So there's really no solution. Also, taking other medications like the little blue pill, Viagra, is not always the solution. Although it may help here and there, it's a band-aid. It's not really finding the cause and treating the cause of your erections not working in the bedroom. This can be very shaming for men, debilitating. We like to perform and outperform ourselves over and over again. And it also can affect our relationships with our significant other, girlfriend, wife, husband, etc. So if you're having problems with your erections, it's very important to get your cardiovascular testing checked, advanced markers, as well as your testosterone and your estrogen checked. Your testosterone and your estrogen ratio needs to be a 40-to-1 ratio. So ideally, your testosterone would be at least 700 total testosterone, and your estrogen would be around 18 to 25 in your blood. So this is something that you can check with your doctor or prior to you come in to our first meeting, and we can make sure that this ratio is all in balance. This also protects your prostate from developing prostate cancer as you age. The other thing, if you're not having sex frequently, make sure that you're at least having sex once a week or at least ejaculating once a week. Ideally more. In the research, they've shown that men who ejaculate 21 times a month are having decreased prostate cancer, which is one of the number one cancers found in men, as well as skin cancer. So I hope this helps for you. Just a couple pointers on how to increase testosterone is doing body weight squats and lunges and deadlifts can really help increase your testosterone. The other thing is not overtraining. So if you're going to the gym 7 days a week and at the gym for 1 to 2 hours, you're overtraining and you're eating up all your testosterone, and you're not going to have enough testosterone to have sex and have an enjoyable sex life in the bedroom. The other thing is stop eating sugar and decrease alcohol consumption. Make sure that you're giving at least 2 days a week consecutive no alcohol to give your liver a break and to help your testosterone come down. 3 things that increase estrogen in men are marijuana. The other thing is beer or high hops brews. They can also increase estrogen in men. and stress. So managing your stress is going to be very important, as we talked about in the adrenal hormone video that you saw already. So go back and watch that video if you haven't really gotten a clear idea of it. And last but not least is you want to make sure that you're having joy in your life, sleeping, and we talked a lot about sleep already, and eating an autoimmune Paleolithic diet or a straight paleo diet, grass-fed beef, organic vegetables and fruits, and avoiding sugars. So all of these things can help increase your testosterone naturally. Here in Seattle and other climates that are higher latitudes, similar to Seattle, Alaska, and other places like New England, Wisconsin, etc., you're not going to get a lot of vitamin D in the winter. So making sure that your vitamin D is around 60 to 80 in your blood and well above the recommended, which is 30. So if you're taking adequate vitamin D, that'll also help your testosterone. I hope this helps you today, and remember to eat that Paleolithic diet, squats, deadlifts, and rest. And you can go ahead and listen to my next videos for other ways to improve your hormone health. Thank you so much.